Hello, everyone, and welcome to our question lab this evening. Tonight's topic is cardiac pharmacology, and we're lucky to have our lead presenter once again, Dr. Paras Vakaria. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident here at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school and then completed medical school, and I've worked with USMLE-Rx as an RX coach for a little over a year now, working one-on-one with students to help them prepare for the USMLE Step 1 and Step 2 CK. And I'm happy to lead tonight's session on a very high-yield topic, cardiac pharmacology.
Excellent. And this is a topic that we've done before, so hopefully all of our veteran attendees are ready for tonight's questions. My name is Sean. I've been with RX Coach for about 2 years. RX Coach is our tutoring and coaching program, which we'll talk more about. We're lucky to have one of our RX coaches with us this evening, and that's Alec. Alec, do you want to introduce yourself?
Sure. Hi, everyone. My name is Alec. I'm a fourth-year med student at Cooper Med School in Camden, New Jersey. I've been with RX now for about 6 months. I used RX when I was studying for Step 1 and for Step 2. I got 260s on both, over 260 on both of them, and happy to be here to help.
Like I mentioned, we do have a coaching and tutoring program. We'll talk more about that later. But what you should know for now is that the methodology we will use in all of our questions this evening will be the same methodology, or similar at least, to what we use in each of our tutoring and coaching sessions. The first step, as you can see, the answer choices are missing, and that is by design. We do that because we don't want the answer choices to guide or dictate your thought process, and we certainly don't want you to see an answer choice you're unfamiliar with, which may cause you to panic as you're trying to answer the question on test day. Once we've covered up the answer choices, we will read the lead-in. The lead-in is the last sentence or the question itself, so let's do that now. Which of the following describes the mechanism of action of this medication? Which of the following describes the mechanism of action of this medication? And once we read the lead-in, we like to ask our students, how many steps do you think this question will require? And we do that because we want you to have an organized thought process. We also want you to have a clear understanding of what the question is asking. This way, when you're reading the vignette, you can pick at all of the relevant clues and hopefully prevent yourself from having to reread the question and waste time. But also that organized thought process should help you help prevent you from making any missteps as you're taking the test on test day. So an example of a one-step question could be, what is the diagnosis? An example of a two-step question could be, what is the treatment for a diagnosis? And an example of a three-step question could be, what is the mechanism of action for a treatment for a diagnosis? So with that in mind, please take a couple of seconds and let us know in the question box how many steps you think this question will require. And we will read the vignette. I see some of our veterans already giving us those responses. And I see a first-time attendee responding. So let's go ahead and read that vignette. A 45-year-old man visits the clinic for an annual physical. He has a history of hypertension, and his medications include hydrochlorothiazide and metoprolol. At the clinic, his blood pressure reading is 168/95. On a follow-up visit 3 weeks later, his blood pressure remains elevated at 160/90. Physical examination reveals a rotund man with androgenic baldness. Normal S1 and S2 heart sounds are heard. An early diastolic murmur is heard in the 5th intercostal space at the mid-clavicular line. He is subsequently prescribed a centrally acting medication to provide additional control of his hypertension. The patient is counseled about the importance of being compliant with the new medication. Suddenly stopping this drug can lead to a severe increase in blood pressure. Which of the following describes the mechanism of action of this medication? I want all of you to start thinking about the important clues and relevant clues in this vignette. Don't jump to the answer yet. Take it one step at a time. And while you do that, I will hand it off to Paras.
Thank you, Sean. So we're going to show you what we think are the important clues in this vignette and the lead-in. So in this question, starting at the top, with the demographics there. So 45-year-old man. So I always think, and most people will agree, that demographics is important to help you narrow your focus. Furthermore, they tell us what his disease is. He has hypertension, the medications he's on, and he has persistent elevated hypertension. And they give us some physical exam findings as well. Now, before I move on, as you remember Sean mentioning just a few seconds ago, reading that lead-in can give you a lot of clues as to what you need to be looking for in that vignette. And so subsequently, you can see that they talk about a medication that's centrally acting. It's important to be compliant because there are certain things that could happen if you stop that drug. In reality, that's really the most important things in this vignette, those last couple sentences. The additional things about hypertension, the actual levels, the androgenic baldness, how much is that relevant here? Probably not as much as the last few sentences. So by reading that lead-in and knowing that this is specifically asking about mechanism of action of a medication, you can focus on what is important in that vignette. So as we can tell, this is a mechanism of medication question, so a pharmacology question. Trying to figure out how many steps this question could be. I think, one, we need to figure out what that medication is. Two, then we need to figure out the mechanism of action. So probably a two-step question here. What's that medication and how does it act? So let's go ahead and take a look at those answer choices, see what kind of mechanistic answer choices they're giving us. And what we see here are some pretty classic pharmacologic answer choices. So I'll go ahead and read those out to you. And what I'm going to do is I'm actually going to start at the bottom and work my way up. So I'm going to start with answer choice E and work my way up to A. And we recommend people do that so it ensures that you get through all of the answer choices. A lot of times we'll see students that will start at the top, they'll see something they like, and then they'll pick it and they won't get through all the choices. So doing it this way ensures that you get through all of them and you're not biasing yourself. So I'll go ahead and do that now. Answer choice E, beta-1 adrenergic receptor antagonism. D, alpha-2 adrenergic receptor agonism. C, alpha-1 adrenergic receptor antagonism. B, inhibition of angiotensin converting enzyme or ACE. And A, alpha-2 adrenergic receptor antagonism. So we're going to go ahead and open up that poll. Go ahead and select the answer choice that you think describes the mechanism of action of that medication. We'll talk about it in just a few seconds.
All right, so we'll give all of you a second here to respond, and once 2/3 of you have responded, we'll go ahead and reveal the correct answer choice, see how everybody did, and go over the correct and incorrect answer choices. I see the answer choices are coming in. Remember that on test day, there is no penalty for guessing and that you should never leave a question blank. And certainly no penalty tonight, so if you're unsure, just take your best guess. All right, I see the responses coming in. Let's take a look and see what all of you selected. In first place with 41% was D, alpha-2 adrenergic receptor agonism, and in second place was C, alpha-1 adrenergic receptor antagonism. So let's take a look and see what the correct answer is. And the correct answer is D, and 41% of you got it right. So well done to those of you who got it right. Let's make sure you got it right for the right reasons. And for those of you who got it wrong, don't worry. Boris is going to explain it to you now so you can get it right on test day.
Thank you, Sean. So Sean has actually pulled up on the next slide a table that talks about this medication. And hopefully you guys who had selected the correct answer choice had realized that it was talking about clonidine. So this is a medication that can also be used for hypertension. As you can see there in the column header, it is an alpha-2 agonist. Under adverse effects, you can see the very last one listed is rebound hypertension with abrupt cessation. So abruptly stopping the drug without tapering can lead to rebound hypertension. So that's why this physician warned the patient not to suddenly stop the medication. So now we'll go back to our actual question slide with the vignette, and we'll see, look again at that vignette to see how that fits in here. So as you can see, it is a centrally acting medication, which clonidine is. It works on central alpha-2 receptors, and it's an agonist there. Importantly, suddenly stopping this drug can lead to a severe increase in blood pressure or rebound hypertension. Clonidine is really the only widely used centrally acting antihypertensive drug. So that's another clue that that was the drug being prescribed here. It specifically is an agonist of alpha-2 receptors in the brain to decrease sympathetic outflow. And that leads to a decrease in blood pressure. So that is now the mechanism. Now that we've talked about those two steps, let's go and take a look at the other answer choices and talk about why those are incorrect. So answer choice E, beta-1 receptor antagonist. These are useful for controlling hypertension, but they work by blocking peripheral adrenergic receptors, not receptors in the CNS. So that would be incorrect. Answer choice C, which I believe was the second most highly selected answer, alpha-1 antagonists. Alpha-1 antagonists are medications such as prazosin, and they do also work to lower blood pressure, but again, they do not act centrally to do that. Answer choice B, inhibition of ACE. These also effectively treat high blood pressure, but again, not centrally acting and also not associated with rebound hypertension if you suddenly stop the drug. And lastly, answer choice A, or alpha-2 receptor antagonism. This would actually lead to an increased blood pressure because it is the opposite mechanism of clonidine. So that would actually increase blood pressure. So that as well is an incorrect answer choice.
Let's move on now to our second question of the evening. Once again, as you can see, the answer choices are covered up, and we will begin by reading the lead-in. Which of the following was likely administered to the patient during his visit to the emergency department? Which of the following was likely administered to the patient during his visit to the emergency department? So we'll give all of you a few seconds here to let us know how many steps you think this question will require, and then we will read the lead-in. All right, I see the responses coming in. Let's go ahead and take a look at the vignette. A 60-year-old man comes to the emergency department because of palpitations, lightheadedness, and shortness of breath. He has had these symptoms since this morning. His blood pressure is 93/61, respiratory rate is 18, and oxygen saturation on room air is 99%. A full cardiac workup is performed, including troponins and a 12-lead EKG. Troponins are within normal limits, and the ECG is shown in the image. The physician decides to order a treatment that will correct this arrhythmia. Which of the following was likely administered to the patient during his visit to the emergency department? Once again, please start thinking about the important clues in this vignette. Don't start thinking about the answer just yet. And with that, I'll hand it back to Paris.
Thank you, Sean. So once again, we will show you what we think are the important clues in this vignette and the lead-in. So again, demographics, we know that this is a 60-year-old man, and we know why he came in: palpitations, lightheadedness, and shortness of breath. Furthermore, they gave us some vital signs that are important. We know his blood pressure is kind of borderline, 93/61. And we know they did a full cardiac workup, troponins were negative, and importantly, they gave us that nice ECG image. The very last line, the physician orders a treatment to correct this arrhythmia. So obviously we know we're gonna have to do a little bit of arrhythmia diagnosis here. Looking at that lead-in, what we think are the important clues there is which was likely administered. So we know the physician ordered a treatment to correct that arrhythmia. What was likely given? So how many steps do we think this question is? I think this is at least a two-step question. I think one, we need to know what that arrhythmia is. And then two, we need to know what kind of drugs can treat that arrhythmia, drug or drugs. And that's probably it. It kind of depends on the answer choices if they decide to take it a step further, but I think this probably could just be a two-step question. So let's take a look at those answer choices and see exactly what we're working with here. And once again, I will start at the bottom and work my way up. Answer choice E, propafenone. D, procainamide. C, mexiletine. B, lidocaine. And A, electrical cardioversion. So we're going to go ahead and open up that poll. Go ahead and select the answer choice that you think was the treatment given for that arrhythmia, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. So once again, we'll wait until about 2/3 of you have responded, and then we will see what the correct answer is and go over the incorrect and correct answer choices. Remember that when you are doing practice questions, it's important to go over the correct and incorrect answer choices to make sure you know why you missed it and to make sure you got the question right for the right reasons. We'll give all of you a few more seconds here. I see about 40% of you have selected your responses. And let's take a look and see what you selected. And it looks like we have a clear favorite with 51% of you picking D, procainamide. And let's see if that is the correct answer. And indeed it is, and 51% of you got it right. So great job to those of you who got it. For those of you who didn't, don't worry. Paris is going to explain it to you now.
Thank you, Sean. Great job, guys. Definitely, I can tell you guys have been studying. So Sean has actually pulled up a nice image here. And first, let's talk about that EKG. So you can see there, this is known as a delta wave, as a lot of you probably know. This is a delta wave that's pretty characteristic of Wolff-Parkinson-White, okay? It is considered an accessory conduction pathway that allows signal to bypass the AV node, okay? So that is essentially what that delta wave is getting at. The ventricles are depolarizing a little bit earlier. So that's why you get that little bit of a slight upstroke there, and that's called the delta wave. And so we'll take a look now at our EKG and the question that they gave us, and hopefully knowing that, you can see that it's not a nice linear QRS complex, but there's a little bit of a slope there. And that's what they're getting at with the delta wave. So this arrhythmia is likely Wolff-Parkinson-White. So then what was used to treat it? Well, class 1A antiarrhythmics, such as procainamide, are commonly used for treatment of aberrant conduction. And you can see here, Sean has also pulled up a table looking at class 1A antiarrhythmics that include quinidine, procainamide, and disopyramide. You can see there, in terms of its clinical use, both atrial and ventricular arrhythmias, especially reentrant or accessory pathway arrhythmias, which is what we are dealing with in this question. So class 1A antiarrhythmics, which are sodium channel blockers, can be used for the treatment of this condition. So that is why answer choice D is the correct answer, and we'll talk briefly about the other answer choices and why those are incorrect. Propafenone, that is a class 1C antiarrhythmic, and those are usually used to treat supraventricular tachycardias, not specifically for reentrant arrhythmias. Answer choice B and C, lidocaine and mexiletine, hopefully you guys remember, those are class 1B antiarrhythmics. Those are usually reserved for life-threatening ventricular arrhythmias, like if you were to have one after a myocardial infarction. They're not commonly used for reentrant arrhythmias such as Wolff-Parkinson-White. And then lastly, electrical cardioversion. This is used to treat arrhythmias in patients who are hemodynamically unstable. This patient is hemodynamically stable, although the blood pressure is kind of a little bit low. is still, from what it seems, alert and awake. So answer choice D would be the best answer choice in this question.
Excellent. Thank you, Paris. And great job to everybody who got it right. For those of you who didn't, that's okay. You'll get it right on test day, right? And I will share with you the QIDs at the end of tonight's session, so you guys can all look this up on your own if you have QMAX. We talked earlier and we introduced RX Coach. RX Coach, like I said, is our coaching and tutoring program, and I see a lot of our coaching students here. But before we talk about it, I want to ask all of you a question. And the question is simple, and don't worry, the answers are completely anonymous. We would like to know, how would you describe the results you are seeing after your study sessions? Well, if you take a look at the results here, you see it's a pretty even split. A lot of you are seeing great results and you're happy, but a majority of you are seeing results that don't match your efforts, you're plateauing, or you're spending too much time and falling behind. And a lot of students like to say, okay, no, I'll figure this out on my own. I'll ask my friends what they did. I'll look up things online. But keep in mind that what worked for your friend or what worked for whoever posted something online may not work for you. And the reason for that is simple. Every student is different. Every person is different. Everybody has different strengths and weaknesses. And everybody also learns differently and applies what they learn differently. But by working with the coach, an RX certified coach, we will identify your strengths and weaknesses. The first thing we will do is administer one of our own assessments to you, or one of the only, or if not the only, tutoring and coaching company out there that has created an assessment. And we'll use that assessment to create a study plan. And what that'll do is two things. One, it'll help you focus, will hold you accountable, but also it'll maximize your study efforts and take the guesswork out of what you're doing, okay? Because time is one of the things that medical students never have enough of, and we wanna make sure you're not wasting it. So we'll make sure that you're maximizing and you're studying in an efficient way. But as we work with you, as we do questions with you, we'll be able to see your patterns and see if you have any test taking deficiencies. So in addition to bridging those knowledge gaps, we'll work on your test taking skills to make sure you can get the score that you want. I see we have a lot of IMGs here, and generally a lot of IMGs do not get as much exposure to multiple choice questions as US medical students or Canadian medical students. So this is very helpful to everybody that wants to succeed on step 1 or step 2, because as you know, the difference between a good score and a great score, or a failing score and a passing score, can be just a few questions, and test taking skills and finessing those can help you get there. You can see here on the screen that our student satisfaction listed on the website is actually a 4.82, but it's gone up over the last several months, and now the average is a 4.9 out of 5. And I think that speaks volumes about the great work our coaches are doing and the results that our students are seeing. So whether you want to, ace it, knock it out of the park and do a 260 or higher, or whether you just want to pass, whatever your goal is, your coach will work with you to get you there, okay? We have students that are already doing great, but they want to do better. We have students not doing so well that want to do better. As long as you want to improve, we will guide you, we will mentor you, and we will support you through the process, and we will be a part of your journey if you would like us to be a part of your journey. If you would like us to join your academic journey, please visit us online at rx-coach.com or rx-coach.com and schedule a free consultation so that you and I can talk about the program and how it can benefit you. If you want general advice, please visit us online at www.firstaidteam.com. All right, so let's go ahead and move on now to our third question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following changes to her daily regimen would be most beneficial? Which of the following changes to her daily regimen would be most beneficial? Please let us know in the question box how many steps you think this question will require, and then we will read the lead-in. All right, I see the answer choices coming in. Let's go ahead and take a look at that vignette. A 26-year-old woman visits her physician for her annual physical examination. The patient has an 18-month history of hypercholesterolemia, for which she exercises, eats a diet low in animal fat, and takes the maximum dosage of simvastatin. Her family history is significant for a myocardial infarction experienced by her father at the age of 38. At her last visit 6 months ago, her LDL cholesterol concentration was 4. Her vital signs are within normal limits. Physical examination reveals yellowish papules and nodules covering the calcaneal tendons bilaterally. She also has bilateral corneal lesions similar to those seen in the images. Today, a fasting cholesterol blood panel shows a LDL cholesterol concentration of 310, an HDL concentration of 50, and a triglyceride concentration of 100. Which of the following changes to her daily regimen would be most beneficial? As you start thinking about the important clues, I will hand it off to Paris.
Thank you, Sean. So we'll go ahead and show you what we think are the important clues in the vignette and the lead-in. So again, demographics. So this is a 26-year-old woman. And we know that she has an 18-month history of high cholesterol. Now, she's been doing all the right things. She's been exercising, eating a good diet, and she's also been taking the max dose of simvastatin. Okay. We do know that she has a family history for an MI in her father at the age of 38. 6 months ago, we know her LDL was 400, and now it's 310 with a max dose of simvastatin. They also give us some cutaneous findings and some ocular findings as well. And so they're asking us, what would we change to her daily regimen? So if this patient came into your primary care clinic, what would you do to change that would be most beneficial for this patient? So how many steps do we think this question is? I think probably a 2-step question, depending on the answer choices. I think 1, we need to figure out exactly what's going on with this patient. You know, there's a lot of things going on here. You know, there's some images there, there's lab findings, there's cutaneous findings, etc. Let's try to wrap it all up together. 2, what would we do to change her daily regimen based off number 1? So probably a 2-step question here. So let's take a look at those answer choices. Answer choice, and once again, we'll start at the bottom and work our way up. Answer choice E, take statin with cholestyramine. And that should say answer choice E. Answer choice D, add gemfibrozil. C, add fish oil. B, add ezetimibe. And A, add atorvastatin. So we'll go ahead and open up that poll. Go ahead and select the answer choice of what change you think is the correct answer to make. That would be most beneficial for this patient, and we'll talk about it in just a few seconds.
All right, thank you, Paris. Take a few seconds here and let us know what you think the correct answer will be. All right, I see the answers coming in. We'll give all of you a few more seconds here. Our topic next week will be anatomy, and then we will release our January schedule and topics towards the end of the year. Remember, as always, we look at attendance as we decide the frequency of these events coming up in 2021. So if you're happy with these question labs, please do tell your friends. All right, and it looks like 39% of you selected add ezetimibe, and 28% of you selected take statin with cholestyramine. Let's see what the correct answer is. And the correct answer is B, add ezetimibe, and 39% of you got it right. So well done to those of you who got it. Let's hand it off to Paris.
Thank you, Sean. So first, let's take a look at the next slide. And hopefully, maybe some of you guys were starting to think about this. But on the next slide, we actually have a table of the familial dyslipidemias, okay? So when they told us that this lady was very young but was having a very high LDL, even though she was doing all the right things, it wasn't improving that much after being on the max dose of simvastatin. And on top of that, her father had a heart attack at a very young age. Those are some things that should really make you start to scratch your head and be like, what's going on there? Is this something that could be genetic? And in fact, this probably was type 2 hypercholesterolemia. Okay, and you can see there in the clinical accelerated atherosclerosis, so early MIs, and then also tendon xanthomas and corneal arcus. So let's take a look at the next slide. I had to throw this in here just because of my dermatology background, but you can see here that these are some important signs of hyperlipidemia. So xanthomas, you can see that a lot of those papules have kind of like a yellowish hue or tinge to it, and that's really telling you that there's lipid in there, okay? And you can see that specifically around the eyelids. Those are called xanthelasma. Now, tendinous xanthomas, they're showing you a picture here of tendons on the hand, but most commonly actually is the Achilles tendon as well. So you'll see what look to be like xanthelasma, but kind of more so on the tendons. And then corneal arcus as well. You can see that whitish hue around the eye there that's common in elderly, what's called arcus senilis, or in elderly patients. But if you have hypercholesterolemia, you can actually see that at a younger age. So we can see that arcuate ring around the eye. So let's go back to our question now that we know this. So in this patient, once again, looking at that vignette, we can see that this patient is only 26 and is going through that. And you can see in that image that arcuate whitish hue around the eye that's suggestive that this patient also has high cholesterol issues. They're telling us about yellow papules and nodules over the tendons. We also know she's on a very high dose of simvastatin, the max dose, and her LDL is still elevated. So that should really clue you in that this is some kind of familial thing going on here. So in terms of what we should do next, in these patients, when monotherapy with the statin fails, the next appropriate step of these answer choices would be to add ezetimibe. Let's talk about the other answer choices and why those would be incorrect. So answer choice E, take statin with the cholestyramine. So cholestyramine, it does help reduce LDL overall, and it can thus be used as an adjunct. However, keep in mind, because of its mechanism, you wouldn't want to take the statin with cholestyramine because cholestyramine can actually decrease the absorption of the statin. So taking a statin with cholestyramine would actually be harmful or lead to decreased efficacy of that statin. So that wouldn't be a good thing. Answer choice D, gemfibrozil. This is a fibrate that's actually used more so for decreasing triglycerides. And we know this patient actually has a normal triglyceride level. Fibrates, on top of that, given in the setting of statin, especially simvastatin, can also increase your risk of myopathy or rhabdomyolysis. So that wouldn't be a good thing either. Answer choice C, fish oil. Fish oil can actually slightly increase LDL, so that wouldn't be good for this patient. Fish oil mainly is used to increase HDL or decrease triglycerides, but you have to be careful in this patient because it could potentially increase the LDL, which is the main abnormal thing. And then lastly, add atorvastatin. In theory, adding a second statin might lower the patient's LDL cholesterol, but you are now facing the much increased risk of liver toxicity and also muscle damage with myopathy and rhabdomyolysis. So that would not be recommended whatsoever. So the best answer choice here is answer choice B. And also on the next slide, the next two slides actually, we've gone ahead and just for your review shown here that ezetimibe lowers that LDL, okay? Cholestyramine as a bile acid resin does also lower LDL, but again, keep in mind, as mentioned in the problems column with cholestyramine, it can also decrease the absorption of other drugs, such as that statin, which is going to be important for this patient, okay? On the next slide are a couple other drugs that were answer choices. So fibrates, as you can see, they're mainly used to decrease triglycerides, which is that third column of arrows. And as you can see there in the clinical problems, increased risk of myopathy with statins at the very far right. So that would not be good. And then lastly, at the very bottom, fish oil actually slightly increases LDL, which is the first column of arrows there. So that would not be good in this patient as well. And so keep in mind all of these different things that these lipid lowering agents can do. Their side effects, their mechanism are all very high yield.
All right, well, thank you, Paris, and great job, everybody. That was a challenging question. Let's try to finish strong. We have one question left. As always, we do have a raffle and a special offer for all of you in attendance, so make sure you stick around because you must be present to win. As always, the answer choices have been removed, and we will begin with the lead-in. Which of the following is the most likely serious complication that can occur as a result of his long-term exposure? And if this question looks familiar, it's because we have actually done this question before. So I'll give all of you a few seconds here to let us know how many steps you think this question will require. And then we will read the lead-in. All right, I see the responses coming in. Let's go ahead and read that lead-in together. A 46-year-old man comes to the clinic for an annual checkup, reporting headaches, dizziness, and palpitations. He works at an explosive factory and is concerned about long-term exposure to industrial chemicals. His physical examination is normal. Laboratory studies show leukocyte count of 8,000, hematocrit of 46%, hemoglobin of 15, and platelets of 310,000. He is found to have increased blood levels of an industrial agent. Which of the following is the most likely serious complication that can occur as a result of his long-term exposure? As you start thinking about the important clues, I will hand it off to Paris for the last time this evening. Paris.
Thank you, Sean. So once again, we'll go ahead and show you what we think are the important clues in that vignette in the lead-in. So again, demographics, 46-year-old man. He is reporting a few things: headache, dizziness, and palpitations. We found out that he works at an explosives factory and is worried about exposure to chemicals. They gave us some lab studies there, and we were also told that there's increased blood levels of an industrial agent, but they just so happen to forget the name, which obviously is our goal to figure out what it is. So, which of the following is most likely serious complication from long-term exposure? So, how many steps is this question? Well, probably a two-step question again. I think one, we need to figure out what this long-term exposure is. And two, what could be a serious complication of exposure to that? So probably two steps here. Let's take a look at those answer choices. Answer choice E, tuberculosis. D, dementia. C, congestive heart failure. B, cardiac ischemia. And A, anemia. So once again, we'll go ahead and open up that poll. Go ahead and select what you think is the most likely serious complication that can occur from that long-term exposure that we'll talk about in just a few seconds.
Thank you, Paris. I guess I misspoke earlier. I have to turn it back over to you one more time at least. So we'll give all of you a few more seconds here to respond and let us know what you think the correct answer is. Cardiac pharmacology is one of several topics that can be challenging and is certainly high yield and important. If you are having trouble with your studies, or if you want to be more efficient and get to where you want to be in a faster time period, and you want help taking the guesswork out of how to study, what to study, and what your strengths and weaknesses are, please reach out to us at rx-coach.com. Set up that free consultation so we can talk about the program. All right, and let's see how All of you did. And it looks like we have a tie. 32% of you selected cardiac ischemia and 32% of you selected congestive heart failure. And close second was anemia. Let's take a look and see what the correct answer is. And the correct answer is B, cardiac ischemia, and 32% of you got it right. It was a challenging question, but don't worry, Faris is going to explain it to you now. Faris.
Thank you, Sean. Definitely a tough question. So let's take a look at what's going on. So this is a table on nitrates. So this is that long-term exposure that he was having, okay? So let's take a look at that adverse effects row. You can see that there's something called Monday disease. So patients who have nitrate adverse effects include headache, hypotension, flushing. We do know that this patient did have a headache as well. But Monday disease is essentially when you're exposed to this as an industrial exposure, and what happens is during the work week, Monday through Friday, you develop tolerance for this vasodilating drug. Eventually, you lose tolerance of that drug over the weekend because you're not at work and you're not being exposed. So you get tachycardia, dizziness, and headache upon re-exposure of that drug when you go back to work on Monday because you've lost your tolerance over the weekend. So because of that, with long-term, what ends up happening is one of the severe consequences is you can get compensatory vasoconstriction, especially in certain important areas like the heart, and that can lead to cardiac ischemia. So this coronary constriction is often associated with that abrupt cessation of nitrates at the end of the week. Okay, so that's why answer choice B is the correct answer in this question. Let's talk about the other answer choices real quick. So tuberculosis, that is likely to be getting at exposure to silica dust, which is not consistent with this patient's presentation. There's nothing really about cough, fever, weight loss, so that's likely incorrect. Answer choice D, dementia, you can get that as a result of certain neurotoxin exposures like mercury, but again, that's not what they're getting at here. Congestive heart failure, that can be a complication of long-term coronary artery disease, but not this exposure of nitrates. And lastly, answer choice A, anemia. That is an uncommon side effect of this patient's exposure. What this patient is at most risk for is cardiac ischemia due to consistent nitrate exposure and then that Monday effect as we talked about.
Excellent. Thank you, Faris. Once again, a challenging question, but a lot of you got it right, so well done. If you didn't, don't worry. It's a learning process, and we hope you will get it right on test day. Now, earlier, we talked about resources and how to consolidate resources, because I know that when you're in school, you have so many resources, you're flipping back and forth, and it makes it a little difficult to stay organized and really can cause students to waste quite a bit of time. So we have out RX bricks, and if you haven't checked it out, here's a brief little demo for you. We talked about class 1 drugs today, so here's a brick on class 1, 2, 3, and 4 drugs. You see here the learning objectives, what we hope you'll be able to learn and what we want you to learn with this learning module. A case connection to give you some relevant clinical content here, which we'll come back to at the end. Then we talk about what are antiarrhythmic drugs. We got flashcards here with mnemonics, and we talk about the different classes of drugs here. And as you can see here, we have a wonderful diagram of the action potential, and you can actually quiz yourself and hide those labels and see what each one is. As you continue to scroll through the learning module, you will see more flashcards, more images, of course, more mnemonics, and eventually you'll finish this learning module and arrive at the end. When you arrive at the end, you will see your case connection, going back to the case connection that was introduced earlier to bring things together, and a summary of the take-home points. And then, of course, you have practice questions to make sure you can test yourself and be comfortable with that material. Then we have a nice little in-training article here to help you with some more relevant information. And then we have our learning objectives that you can select and mark off depending on how confident you are with them. And this is the part I was talking about helping you stay organized and stop having to flip from resource to resource. You can go directly into First Aid, our digital version here. And keep in mind the new version will be out at the end of the year. You can study with flashbacks, you can watch express videos, or you can quiz yourself with our question bank QMax. So if you haven't taken a look at Bricks, I highly encourage you to do so. We have some really high achievers and super achievers that have used these to their success, and I believe you met one of them earlier today.